The Yucatan Peninsula of Mexico is rich in nature and history. This home of the Maya is a flatland dotted with pyramids, exotic birds, and culture. Merida, the capital of the state of Yucatan, was founded in 1542 by Francisco de Monteo, a Spanish conquistador. Built on the site of a Mayan city, Merida has grown to become one of Mexico's largest urban areas. The Yucatan is home to reptiles, jaguars, flamingos, and mosquitoes. In the last decade, infectious diseases transmitted by mosquitoes have become a serious problem. Mosquitoes are to blame for major outbreaks of some horrific infectious diseases like dengue fever. Researchers from Colorado State University have come to Merida to study the problem of mosquito-borne diseases and to find solutions.
In about 1995, a very severe form of dengue started to appear here. It was called dengue hemorrhagic fever and shock syndrome. This is a disease that affects probably 50 to 100 million people a year. Hundreds and hundreds of thousands of people have hemorrhagic fever and shock syndrome. It can infect so many people in a community that it has a major socioeconomic impact.
Dengue is a disease caused by any one of 4 closely related viruses. Dengue hemorrhagic fever is a more severe form of dengue. It can cause high fever, joint pain, and bleeding of the skin, nose, or gums. If not treated properly, it can be fatal.
We have estimated that more than 70% of people in the area of the Merida and the Yucatan have contact with the virus. So it's very important. We have every year we have epidemics, different dimensions. Sometimes they are very big.
One of the big problems with dengue is there is no vaccine. People have been trying to develop dengue vaccines for 40 years with no luck. If the dengue epidemic is really started, it's everywhere, and so you can't.
Barry Beatty is a member of the National Academy of Sciences and one of the world's foremost experts on how vector-borne diseases are transmitted. His research in mosquito-borne pathogens has taken him from his lab at Colorado State University to tropical areas throughout the world. He got his start in the early 1960s in La Crosse, Wisconsin, working on a deadly new disease called La Crosse encephalitis. It's a mosquito-borne virus that can affect the central nervous system and cause severe complications and even death. It usually affects children. Today, dengue is the most important mosquito-borne viral disease affecting humans. 2.5 billion people live in areas at risk for dengue fever and dengue hemorrhagic fever. Again, most fatal cases affect the very population Beatty hopes to protect.
I don't think any children deserve to be sick. And when you look at these children, many of them in neighborhoods that are quite poor, there are no window screens or anything like this.
Part of the problem is that for a while, World Health officials didn't think there was a problem. In the 1960s, mosquito control was so effective that many types of mosquitoes and the infectious diseases they carry were considered to be under control.
The United States especially went through a period of remarkable lack of infectious diseases. In fact, in the 60s, the Surgeon General said that infectious diseases are dead. The pathogens, the parasites, the viruses, the bacteria, the mosquitoes, the ticks, etc., didn't pay any attention to that. And now they're back and resurgent in just an unprecedented way. So what has happened? The mosquitoes have become resistant to the pesticides, or pesticides have been removed from the market. The parasites have developed resistance to the therapeutics. There are no vaccines for others. So it's just a perfect storm in many respects. So there are more mosquitoes, more virulent viruses now associated with or being transmitted in Mexico. And so hemorrhagic fever and shock syndrome, a very, very serious disease, is now very common in Mexico. What we wanted to do here in Merida is to collect as many mosquitoes as possible. Like we were
It's believed that new strains of the dengue virus have been introduced from Southeast Asia, and the mosquito that transmits the virus has become more and more common.
So for the major disease that we work on here in Yucatan, dengue virus, the vector of that is a mosquito called Aedes aegypti. Now that mosquito is very, very adapted to humans, and she lives in the house. She typically only goes out of the house to lay her eggs. So if we want to know how many Aedes aegypti are around, we have to go in houses and take that device, which is essentially a big vacuum machine, and go under the beds and in the closets and behind the counters and everything, and suck up the mosquitoes, because that mosquito does not come to artificial traps very well.
Beatty and colleagues at Colorado State have teamed with the Universidad Autonoma de Yucatan and local health authorities to study the transmission of the dengue virus in Merida and to halt its explosion. The research project in Merida is seeking to attack the dengue dilemma with two major approaches. One is to work with the medical clinics in the colonias, or neighborhoods, and monitor when and where infection occurs and then provide early warning of dengue epidemics. The second is a new approach where they hope to prevent the mosquito from living and feeding in the house.
Dengue transmission occurs in las escuelas or in la casa. So we're going to try to have better dengue control by instituting what we call a Casa Segura. That is to try to stop the mosquito from biting people in the house. And so this is quite exciting. There are new technologies that are available that we can use to do this. Long life insecticide-treated curtains. These curtains are effective for up to 5 years. So if we can put these in the houses and so forth, this would be very, very good. These types of houses are ideal for this kind of strategy.
The traditional Mayan hut is built to allow the breeze to cool the house. New construction is designed to let the breeze in and keep the mosquitoes out.
We think that we can protect a typical house for several years for less than $5, as a matter of fact. Now we have to do studies on this to see how well these materials hold up in the American tropics and places like Merida, how useful they will be and so forth. But the excitement is that all of a sudden there is a long-term treatment approach for these diseases that are transmitted in the house.
Not very, very close.
Yeah, they come to here instead. They go to the closest clinic.
Yeah.
Tracking disease at the local clinics will hopefully lead to a faster response to the spread of dengue.
This is a free clinic. This is where most of the patients that are being infected with are sick or ill will come in, and they will meet the physician epidemiologists here. Those physician epidemiologists will care for them. If it's a very severe illness, they will be referred to one of the local hospitals. In these clinics, we're establishing partnerships with the physician epidemiologists. They're the ones that see the patients first. This is where the serum samples are obtained for diagnosis. So these are very, very important clinics. These clinics are the first line of health for things like dengue and other diseases.
Creating partnerships with local health officials is vital to helping the mosquito control people to quickly locate and control the mosquitoes, thereby stopping the epidemic.
We're getting this program established, and we're actually, as you have seen, working with the physicians, the nurses, and the epidemiologists in clinics like this one right next door. And we are going to involve them in this study in a major way. So we are going to go out and talk to all the people in this colonia. We're going to get their buy-in, their consent to participate in this study. And then we will follow them for the next several years to see if they become infected with dengue. We're also going to follow their houses to make sure that the mosquitoes are not transmitting the viruses in the houses and so forth.
The dengue cases in the past have followed the rainy season when most mosquito breeding occurs. But lately, Merida has seen outbreaks throughout the year.
This year it's interesting because it's starting very, very early in the year.
The Arbovirus Lab at the Universidad Autonoma de Yucatan plays an important role in identifying the virus and collecting data for the project.
It's a really big problem and not diminishing, increasing, because we can see that before we might have less severe cases, just a few dengue hemorrhagic fever cases, but right now more severe, more cases, and throughout the year. It's not just a few months. And we have been confirming 40–50% of them as dengue.
Wow.
Dengue 1, dengue 2, dengue 3 are circulating.
One of the things we're trying to do is to change the way that the vector mosquito of dengue is controlled. Currently what happens when a case of dengue is diagnosed, the mosquito control people will come in and clean up the breeding sites around the house. They will also then sometimes go in and spray the house to kill the mosquitoes right in the house. The problem with that is it takes a long time to get a diagnosis. What we hope to do is to get this early warning system, so to speak, where we can go in right away. If there's a cluster of fever and headache cases and so forth, then we can have the mosquito control people come in much, much sooner. So we hopefully can stop the epidemic before it gets started.
Developing that early warning system is a big piece of the puzzle.
Everybody recognizes that vector control as it's now constituted is just not that effective.
Historically, control efforts target the juvenile stage of the mosquito. The control teams find the breeding sites where the mosquito, Aedes aegypti, lays her eggs. When the rains come, the mosquitoes emerge and fly into the house to feed. The control teams then either dump all the water out, or for drinking water, add a chemical called temophos to kill larvae.
But unfortunately, the mosquitoes are becoming very resistant to temophos, and so there's no other real good alternatives at this stage to control them. So what we want to do is to start controlling the adult female mosquito in the house itself. So it's based upon these technologies that have been developed for bed nets for malaria control. But the major breakthrough is that the insecticide is actually integrated into the net, into the material.
The Aedes aegypti mosquito will feed in the house throughout the day and evening. Keeping mosquitoes out of the house should not only help in fighting dengue fever, but also help prevent other vector-borne diseases.
The exciting thing about it is not only theoretically will it prevent the Aedes aegypti mosquito from coming in the house, but also any other blood-sucking arthropods, such as Culex mosquitoes, things like rejuviate bugs, the vectors of Chagas disease, and so forth. This is the one we went to last year, right?
Yes.
To see all the Aedes aegypti?
Researchers are using current technologies to develop a dengue information system that will be used to make the best decisions possible in the effort to control dengue.
Well, we have something that we're calling a dengue information system that has many different components. It will be a computer-based system incorporating GIS software and some analytical software.
At the Arthropod-Borne and Infectious Diseases Laboratory at Colorado State, a team of researchers works to create a system that will easily fit in with existing control efforts.
The idea is to make it simple, really simple, and also make it inexpensive, and do not intrude much in what they're already doing as vector control people.
The GIS software provides a map for the entire state of the Yucatan that shows cities down to the street and block level.
And then you can collapse all this data by time. You can say by week, by day, by year. You can make a time lapse and show it over time how these epidemics are spreading inside your city.
This year, mapping showed that a cluster of current dengue cases surrounded a large cemetery in Merida. Mosquito control people discovered that the flower pots at the graves had become a major breeding site for Aedes aegypti mosquitoes. While honoring the dead, people were unknowingly supporting a deadly disease. So the control team drains water from the flower pots and collects mosquito larvae to be taken to the lab for analysis.
It's very important to know what happened in the past to be able to put together effective intervention schemes for the future. Merida here in the Yucatan is one of the places where we'll be operationally testing the system to make sure that the things that we put together in a lab at Colorado State University actually will work on the ground and will help people on the ground.
A deadly strain of West Nile virus came to North America in 1999 and then began to move west across the continent. Introduction of this deadly virus into Mexico was of great concern because of the abundance of vector mosquitoes there. Since West Nile virus is spread by mosquitoes, scientists studying dengue were ready to track West Nile as it entered Mexico.
We were the first to show it was introduced into Mexico, what birds were bringing it in, what was going on in that regard. In fact, the training and the people and the programs that had been set up in the context of the dengue studies could then very quickly be used to study West Nile virus. Now that's a much different virus. It's transmitted amongst birds instead of amongst people, and only infrequently do humans become infected. But thus far, the virus that has been introduced to Mexico from North America is not a very virulent virus. At least that's our hypothesis. Because even though we know the virus is circulating here in Merida, there's been really no deaths in horses, deaths in people, and so forth. But we don't know if that will change or what.
It was decided to test for the presence of West Nile by trapping birds and taking blood samples to the lab. Rio Celestun, on the Gulf Coast near Merida, is a major wintering zone for migratory birds.
Pretty fascinating place. It's nice that it's protected.
We wanted to look first at migratory birds. And so we trapped birds around cenotes and iguates. We trapped birds in for example, Rio Celestun, where millions of birds from North America come to the beautiful Yucatan to overwinter every year. We set up nets, we capture the birds, we put a band on their legs, we take a blood sample, and we found out that in 2002 the virus had been introduced into this part of the world.
Yes!
And good nights, this will just be full of mosquitoes. It's a bag of mosquitoes.
The zoo in Merida proved to be a good place to test for the presence of West Nile in the city.
The intent was to find out if the virus is in the mosquitoes here in Merida. The zoo brings together essentially all of the components of the West Nile virus cycle. It brings in the birds, many species of birds, of course, are here in the zoo. Because of the water around for many of the animals, there's ample breeding sites for Culex mosquitoes. And so these things are set up a natural ecosystem, so to speak, for West Nile virus transmission. So this is a very good environment for Culex.
Mosquito traps at the Merida Zoo are able to attract and collect mosquitoes that can be tested for the presence of the West Nile virus. A vacuum-like device also was used to gather mosquitoes in the reptile house.
So the adult mosquitoes love to come in a place like this.
Mosquitoes are taken to the arbovirus lab for analysis.
So then we can come in and take those mosquitoes the next day. We take them across the street to the laboratory, identify them, look to see if they have blood meals, so forth and so on. After we identify them and so forth, then we try to isolate the virus from them.
Blood samples from many of the animals at the zoo test positive for West Nile, yet there have been no fatalities or harmful effects in birds or animals.
Well, once an animal is infected, then it develops antibodies to the virus. So a number of these animals were infected. They had antibody to West Nile virus, but no disease, which is really quite interesting.
Researchers in the West Nile study are trying to understand why the virus in Merida is not causing disease like the virus did in the United States.
In Merida and the Yucatan, southern Mexico, many people have been infected with dengue virus. Dengue virus is a related virus to West Nile virus. And maybe if you're infected with dengue virus, the antibodies that you have made to it somehow help protect you against West Nile virus infection.
One theory is that migratory birds from the U.S. that had a severe strain of West Nile were not healthy enough to survive the flight across the Gulf. The birds that made it to the Yucatan likely had a less severe form of West Nile. The collaboration between Colorado State University and the Universidad Autonoma de Yucatan not only helps to fight disease, it should also lead to a new generation of researchers and scientists.
These problems really do exist on a global scale, and if we are going to make a difference, and that's certainly part of our culture at Colorado State, helping to train and develop cadres and networks of scientists worldwide is really very critical.
Having this type of collaboration is just excellent because we will give us information. We might have basic research here and advanced research possibilities to apply again back to this area.
One of the things that is exciting to us, and I think exciting to the faculty here as well, is the possibility of creating networks of universities that really partner with each other, take the strengths of the various institutions and pull them together to address, in that multidisciplinary manner, these great global challenges, particularly with an eye to getting solutions to the people and the communities that need them most.
Many years of research through this collaboration has scientists excited about putting an end to this major threat to world health.
This work is based upon over 10 years research that we've been doing with people at the Universidad Autonoma de Yucatan. Very good colleagues such as Jose Farfan, Maria Abel Pino, and so forth. And so we've had a very good relationship doing basic research with our colleagues here. But now we want to take it to a new level and actually use all that knowledge that's been accumulated over the years to try to control this very, very serious disease.
This is a real problem that we have here. So if we can test something that works, it's going to have a very important social impact in our people. And this success, if that happens, can be really transported to other places that share similar conditions to Merida.
So we hope within a couple years we'll have a real, what's called a proof of concept, a demonstration that this particular approach works. And there have been a couple of very small studies that suggest it's going to work, but this is the first time going into the major urban areas where this is really going to be looked at. So once we have that proof of concept, because we are absolutely integrated into the public health programs of the city of Merida, of the state of the Yucatan, and interacting very, very frequently with the Ministry of Health in Mexico City, we think that this sort of program will generate lots of interest from the governments, not only from the governments, but also from the Pan American Health Organization and from the World Health Organization. So we think this intervention that's being set up for prevention of dengue transmission in the house may also work for leishmaniasis, may also work for malaria in sub-Saharan Africa, may also work for Chagas disease in South America. So it's an intervention that potentially goes beyond just one disease.
For the team of researchers, the challenge of scientific discovery is always stimulating. But the promise of being able to help prevent many of the world's worst infectious diseases is exciting.
In some of the very, very poor areas, people may be bitten 100, 200 times a night by mosquitoes. Just controlling that would be wonderful, you know, just the pest aspects of it. But to go the next step and to help them in their health and happiness, I think is a very, very laudable goal.